Hey guys, this is the first official video for Farty's World. It's also a little bit of an education video on rhinoplasty. The process of going through rhinoplasty. I'm going to be going through the process in about 2 days. Been a long time dream of mine to actually get this done. I was advised by doctors ages ago to just basically do it when I was 25, and I'm 25 and I've sorted it all out. Hopefully I should show you guys in the next 2 days the process that I'll be going through. So I really looked on YouTube for a really long time for a video just to sort of help me out, because I've got a really bad rhinoplasty issue. My septum is actually deformed out to the right. I'll let the doctor and all the rest of it hopefully explain this if he's keen to come on camera. Alright guys, so it's Monday morning. I'm just going to go through what we exactly needed a year prior to getting all this work done. So what do we need? We needed a health fund for 1 year. So you need to make sure that you have the health fund with the item numbers that they give you for the surgery. So for mine it was rhinoplasty. Can't remember exactly what the item numbers were, but there were item numbers in there that I had to make sure were a part of my general fund for the 1 year, including the hospital admission in there. So your excess will be different to mine. Mine's $750, but your excess might be a little bit different. And then once you've got that sorted, you basically go in for a surgeon consultation. So you go in for a general one that goes in at that first, and then from there, once you go in for your consultation, they'll run you through the next steps for the procedure. You usually have to wait about a year, and then you book in your surgery. So in this part, they give you photos, before and after photos of what you expect it to look like, and I'll show you guys mine as well. And then you run through the next steps to book in the surgery. So you've got to make sure everything's sweet, that you're both on the same page, and then you book in the surgery and you go from there. So mine's going to be tomorrow, which is pretty exciting, and we'll see how that goes. So I'll give you guys the update from the doctor's office, and hopefully show you guys some of the videos from there, or some of the audio, depending on what they prefer.
I'll just do like that. Yeah, nice. So Fatty, in your nose, everything's slightly asymmetric.
Yeah.
Your septum's really off to one side, your whole nose is off to one side, the teeth don't line up quite right. Yeah. And I showed you a skull, your palate and even all that too. Yeah. Now, remarkably, I think when you smile, your teeth
bring it all in.
Yeah, but they're actually not too bad.
Yeah.
Given I've forgotten what orthodontic work, if any, you've had done.
None.
Yeah. So they're actually not too bad. We'll give everything's considering. Yeah. Now, when it comes to fixing your nose, it's done in hospital under general anaesthetic. So you're completely asleep. You're going to come into hospital. You'll be told the time when you need to come in this afternoon. They'll give you a time when you have to fast, so you'll be completely fasted. So now you've got your cartilage poking out on one side.
Yes.
But when we do your formal airway testing now, you can really see that your right-hand side is super occluded. It's 8 times higher resistance, or 7 times higher resistance on that side than the other side.
Yep.
There's no surprises there.
Yeah.
Now you sat down with me and said, look, Richard, I've recorded from our last interview that you want to get your breathing right, and you're a good-looking guy. We just want to straighten the nose, both from a front view and a side view perspective. And so I did some photos for you that I want to just talk to you about, because they raise some issues just about your general facial symmetry and what maybe we should try to go towards. Yeah. But I just want to go through the surgery itself. So it's done under a general anaesthetic. Yeah. You need to, let me just pull up some example photos here. So this is an example patient of someone who's just got a big nose,
Yep.
has trouble breathing as well. When we do the incision here, we make a little incision across this area. It's called the columella, the place between the nostrils. When you wake up from surgery then, you'll look a little bit like this. You'll have some bruising and swelling, you'll have a cast on the nose, you'll have 5 little stitches, a little bit of blood.
rounds. Yep.
Yeah.
With
It's
the
not
surgeon.
too bad. He's about middle of the road. You know, he's not neither less than most, and he's not more than most. He's about middle of the road. So you do look like you've had an operation. When you come back and see me at day 7,
Yep.
so you don't have to stay in hospital. You can go home the same day.
Yeah, I'm going to get my sister to take me home probably straight away.
Yeah, as long as you tolerate the anaesthetic and there's no issues, you're eating and drinking comfortably, the anaesthetist is happy and you're comfortable, happy if you go home. You don't need to stay overnight for this operation. We'll give you information about how to look after your nose. You'll come back and see me at day 7.
Yep.
And at day 7, we'll take out these little stitches, but that's all we'll do.
Yeah.
The cast stays on the nose for 2 weeks, and I'll show you some examples of people what they look like at 2 weeks.
Yep.
But the cast stays on in 2 weeks, and that's really important because it helps to mould the skin over the new framework that we create.
Okay.
Now, when you come back at week 1, the incision actually heals pretty well. You know, so here's a guy with similar skin consistency to you. He's got Mediterranean skin. You know, he's healed pretty well even at 1 week. And I'll show you what he looks like actually down the track. We go straight to his 3-month view. So he's now got a nice sort of straight shape. And if you look, you can barely view. It's a little solid looking. And then of course, 3 months later, when the swelling goes down, she's got like a nice shape.
Yeah.
Nose. And you'll go through something like that as well. It takes a little bit of time for the skin to mould over the new framework.
Okay.
Now, as an operation, it's pretty safe, but there
Yeah.
are some risks involved.
Yeah.
You run a small risk of having some bleeding.
Yeah.
It's about 1 or 2%. This is because inside the nose there are little tissues we cut, especially because we have to move some of the internal parts of the nose called the turbinates around and makes one smaller so that everything can shift across.
Yeah.
We seal up little blood vessels in a machine called a diathermy. We're not perfect at it. Your body's not a perfect healing machine.
Yeah.
And the rate of what's called secondary hemorrhage or bleeding is about 1 to 2%, and it's there for about 3 weeks after surgery.
Okay, so you could have possible bleeding, random bleeding.
A nosebleed.
Nasal
yeah,
bleed,
a nosebleed. Now this risk of having secondary hemorrhage is probably true anywhere in the body, but if it was just on your leg, you could just put some pressure on it. Because it's in the nose, that 1 or 2% risk means that you might have a risk of needing someone to help sort that nosebleed out for you. You can't do anything to reduce this risk. It's just the imperfection of healing, but you can be aware of it.
Yeah.
So don't put yourself in harm's way by travelling somewhere remote,
Going
somewhere to an area where there's no medical care.
Okay.
You know, travelling overseas to remote areas.
Yep.
This is like where you could turn a simple nosebleed into a bigger problem.
Okay, so if you get sort of excessive bleeding, I should sort of ring 000 and sort of go.
Well, you just go to your local hospital.
Yeah,
you don't
yeah,
necessarily need to ring 000.
Okay,
000 is really for
if I'm out like on a
absolute
job
emergency.
site or something and I can't get there myself. That
All
sort of thing.
hospitals have little sponges like this.
Yep.
And they can easily put it in the nose and just stop the bleeding, and then you
Yep.
just give me a call. But it's about getting first aid.
Okay.
Having someone at least be available to see someone.
Fingers crossed, hopefully we won't have that issue. Fingers crossed.
But it's 1 or 2% of
Yeah.
patients,
Thank you
and
for telling
not
me.
all patients need something like that done, but 1 or 2% will have some use. When it comes then to serious things that can come up during the surgery, you run a small risk of having an infection. The
Okay.
rate of infection for rhinoplasty is less than 1%,
Yep.
but it can happen. It's one thing if it does happen, it might induce a bit more care. We'll have to come back into hospital, have some antibiotics for a drip.
Yep.
And we thought the nose was affected by the infection, maybe an early second surgery to get it back on track.
Okay.
That said, though, infections are pretty uncommon. We do give you antibiotics at the time of surgery, and the bare minimum you need is a dose at the time of the procedure. I actually give you a course for 10 days afterwards,
Yep.
and because I think that actually helps reduce that risk again.
Yep.
I'm keen for you to take that, unless you have side effects like stomach upset or some
Yeah.
issue. So I'm keen for you to follow our regime.
Solution as in.
The regime I give you is a combination of antibiotics, tablets, and some antibiotic ointments.
Oh, so it's like medicine.
Like medicine.
Yeah. Okay.
And
I'm
you-
thinking like
and
a
you-
training course.
And you get an injection of
Okay.
antibiotics at the time of the procedure.
Okay. Beautiful.
When it then comes to other things, and there's lots of little stuff I'm happy to talk about. I know I've given you an information sheet already.
Yeah.
Did you have a chance to read all that?
I did. I try to have a look as much through the fasting, the stuff that you shouldn't be sort of on, all the aspirin stuff and all the rest of it.
What about the information sheet itself about the surgery? Because I think the information sheet I gave you about surgery goes into all sorts of things: thickening of skin, pigment changes of the skin,
No,
all these sort of things.
Yeah.
Well, I tell you what, let me give you that information sheet again.
Yeah.
And if anything you see you want to talk about, I'm happy to chat about it.
Yeah. Just in regards also to the photos as well, I think.
Yeah, no, we're going to do the photos here in a second.
Oh, sweet.
Yeah. So I'll give you another information sheet about surgery of the nose, and there you go. And if you, now the final one for me is really important. Is that when you have surgery on your nose, I mean, although I often have to deal with people with very complicated noses, and actually 2/3 of my patients have already had an operation when they come and see me.
Yeah, well.
I'm not a magician. I don't get everyone perfect.
No, I don't expect you to be. Don't worry.
But I do so 95% of the time.
Yeah.
So 19 out of 20 patients have one operation, very happy with this result cosmetically and functionally. But there's about 5% of my patients in which there's something that we do along the way to get them to the final endpoint where we want them, like some little touch-up or minor surgery to really address sort of some minor concerns.
Yeah.
That's part of the rhinoplasty journey, and I think if you go down this pathway, we try very hard to do one procedure for you,
Yeah.
but if we need to do some little revision or touch up to get you the right result, then we're just keen to see you get there eventually.
Yeah.
Now, when it comes to the photos, I just want to pull these up. You had 2 requests for me. You said to me, I want a straight nose.
Yeah.
And I said just from straight from it, and I want to breathe better.
Yeah.
So on the front view, one of the things I want to point out is that your philtrum here, see this?
Yeah.
Sits well off the midline.
Yeah.
So actually, if you look at your philtrum there, it doesn't sit in the midline, which just raises a little issue about how do we then line up your nose.
Yeah.
If we line up your nose and try to get it straight with your philtrum, this is sort of how it will look.
Yeah.
And I think you might look at it and think, well, it's slightly off to the right still.
Yeah, that's right. Yeah.
Yeah. Now I point that out for you now. One of the things I can do is really try to center it on the eyes.
So fudge a little bit.
Well, you push it across on the other side of the philtrum a little bit.
Yeah.
Now a little bit, I used to show everyone who had an asymmetric face this photo.
Yeah.
And I think I did it really because I wanted to show them their natural facial line. If you said to me I was a rhinoplasty surgeon, I probably don't go for this look.
Yeah.
I actually try to straighten the nose relative to the eyes, and it means then your filter and mouth just looks slightly off center.
Yeah.
I personally like that aesthetic, but there's not one that's right or wrong for your face.
Yeah.
I think it's more about me showing you the fact that
Both sides and comparing the both.
there's an asymmetry to your face, and then we have to sort of decide, are you happy with this, or would you like it slightly more centered with the eyes, and so the mouth looks ever so subtly off?
Yeah, it's a weird one, right? Because it feels like the right-hand side where I've got this little thing just here sort of collapsing inwards. But then again, that's just
shadowing.
That's just probably the shadow of the light and that. Yeah, honestly, I mean, from what it's going back and you're doing the back and forth one, you can really see the difference. Obviously, the obstruction wouldn't be there, so I'd be able to breathe a little bit better.
Of course.
Yeah, I don't expect to look like a prince when I come out of this, but
But I think we're going to try, as long as you are on the same boat. Are you happy for me to use my best judgment here?
Honestly,
at the time of the surgery, if I feel it looks better centered on the eyes, we'll do that. If it looks better centered on the philtrum, we'll go with something closer to this. How do you feel? Or do you feel strongly one way or the other?
The image that you just had before, you had like 2 images just before. That one right there. So I think obviously my eyebrows are off to the right on that one a little bit more. I'd rather you do your best and just try your best, regardless of whatever outcome. That's between the works and God, I guess.
Honestly, you don't have a preference.
I look, honestly, at the end of the day, my nose has been bent my whole life. I don't expect it to be fully
But do you understand that the concept here is not just what you expect, it's about understanding that your underlying face
That's right.
is asymmetric.
Your
teeth, your philtrum don't sit in between your eyes.
Yeah.
And so where do we place the nose?
Yeah.
If we place the nose directly in between the eyes, if we try to go for that, it'll give your mouth a look like it's slightly off to one, ever so subtly. A little quirky look. But if we stick purely to keeping it in line with your philtrum, it'll make your nose look like your whole face. A little bit of a swing to the right-hand side.
Yeah.
Because your jaw's off to that side and everything else.
Yeah.
I mean, I think you got to remember, no one looks perfectly symmetric.
No, that's right.
But you and I have to be comfortable with which maybe we go for. And if you say to me, Richard, I don't have a strong preference either way, I will do what I will centre it as best I think looks appropriate for your face.
Yeah. So I would I'm honestly I wouldn't say that I'm not too happy with that, because I am, in a way, like, it is sort of fixing the underlying issue from the inside out.
You're reasonably happy with
at this
you
point.
You gave me a double negative. It means you're reasonably happy with this photo.
That is right. That is right.
Now on the side view, there's your nose there.
Yeah.
And I said probably just need to be a bit closer to that, 1 week. And I'll show you what he looks like actually down the track. We go straight to his 3-month view. So he's now got a nice sort of straight shape. And if you look, you can barely make it out.
Yeah.
But it's pretty cosmetically acceptable.
Yep.
Now that's the incision and what you look like. Now you will be a bit puffy and swollen. So let me show you then. Here's a girl who's got quite a deviated side nose.
Yep.
We just planned a straight nose. She's got a slightly unflattering side profile, and we were just trying to make it straight. Here's what she looks like when the cast comes off. Cast has come off, nose is nice and straight. It's a little puffy and a little bit swollen.
Yeah.
But acceptable enough that if she was to walk down the road, you wouldn't notice she had something done. But certainly from a front view, she's a little solid looking. And then, of course, 3 months later, when the swelling goes down, she's got like a nice shape.
Yeah.
Nose. And you'll go through something like that as well. It takes a little bit of time for the skin to mould over the new framework.
Okay.
Now, as an operation, it's pretty safe, but there are some risks involved.
Yeah.
You run a small risk of having some bleeding.
Yeah.
It's about 1 or 2%. This is because inside the nose there are little tissues we cut, especially because we have to move some of the internal parts of the nose called the turbinates around and makes one smaller so that everything can shift across.
Yeah.
We seal up little blood vessels in a machine called a diathermy. We're not perfect at it. Your body's not a perfect healing machine.
Yeah.
And the rate of what's called secondary hemorrhage or bleeding is about 1 to 2%, and it's there for about 3 weeks after surgery.
Okay, so you could have possible bleeding, random bleeding.
A nosebleed.
Nasal
bleed.
bleed.
A nosebleed. Now this risk of having secondary hemorrhage is probably true anywhere in the body, but if it was just on your leg, you could just put some pressure on it. Because it's in the nose, that 1 or 2% risk means that you might have a risk of needing someone to help sort that nosebleed out for you. You can't do anything to reduce this risk. It's just the imperfection of healing, but you can be aware of it.
Yeah.
So don't put yourself in harm's way by travelling somewhere remote, going somewhere to an area where there's no medical care, travelling overseas to remote areas.
Yeah.
This is like where you could turn a simple nosebleed into a bigger problem.
Okay, so if you get sort of excessive bleeding, I should sort of ring 000 and sort of go...
Well, you just go to your local hospital.
Yeah,
you don't necessarily need to ring 000.
Okay,
000 is really for...
if I'm out like on a job site or something and I can't get there myself.
Yeah. All hospitals have little sponges like this.
Yeah.
And they can easily put it in the nose and just stop the bleeding, and then you just give me a call. But it's about getting first aid.
I'd love to be able to breathe out of my nose, so...
I think you'll get a great result.
Hopefully...
people in your situation are usually very happy they eventually got it fixed.
Yeah.
And it's just about whether or not we can get you the perfect nose.
That's right.
In one procedure, whether we have to do something along the way to get you there.
Yeah.
But I think, regardless, I think you'll find that you can take a huge step forward from where you are now.
Yeah, no, I just want you to do, your best judgment. You're teaching a few boys here, so you're more than the qualified man for this. So I'm just going to completely put my trust in you.
Yep. That has to happen always at some point when it comes to surgery. But I appreciate your faith there.
Yeah.
And listen, I mean, like I said, having an asymmetric nose, having an asymmetric face, none of this is, really impacts my surgery. It's just about being aware of it.
Yeah.
We're quite used to having patients have those sort of issues. So I'm happy.
Beautiful.
Do you feel like you're ready for tomorrow?
Yeah, I'm so excited, man. I'm so excited. So nervous, but so excited at the same time. So it should be good. It should be really good. I'm taking time off work this whole period. So
is there anything else you want to know from me?
we're good there. It's